This is what change looks like.
Our first guest, Congressman Michael Burgess, a Republican from Texas and chair of the Health Care Caucus. Representative, given your druthers, would you prefer to try to amend this bill and improve it to create either in a national exchange, more freedom, more choice, all the things we've talked about for years, or repeal it altogether? And why do you choose the answer that you do?
Well, it can be very difficult to repeal this bill. Number one, there aren't the votes in the House to do that until November. And if we were to get those votes in the next Congress, the president in the White House would probably have a different set of ideals that he's following, and so a veto would result. If we pick up a majority, I don't think we're going to pick up a veto-proof majority. So the short-term answer is you've got to try to fix some of the things that are just wrong with this bill. And realistically, as we've gone through this past year, I mean, there's been no shortage of targeted fixes that many of us have talked about. The question is now, can we apply those targeted fixes to what is basically a big problem for the American people?
So what would be at the top of your stack of amendments?
Top of the stack of amendments would be, hey, how about if we treat everybody equally, that Medicare doesn't mean a different benefit in different parts of the country? Another might be, do we really need an individual mandate in order to sell insurance products? How about if we incentivize people to buy insurance rather than mandate that they buy insurance? Look, does anybody believe prices are going to come down on insurance policies when the insurance companies have a mandate that you've got to buy their product, or the IRS comes calling? What incentive does the insurance company now have to hold down rates and rate increases? In fact, Congressional Budget Office themselves said the average American family will see a $2,100 increase in their premiums under this bill.
But isn't the rational amendment to deal with that either to basically make the exchanges open to everybody in America so there's honest competition for health insurance, introduce a public option to keep the insurance companies honest, or at the very least create a voucher system or a tax credit for people so that you basically further empower customers? Right now you've got the government creating customers by law, but you have the seller of the product in the form of the health insurance companies protected by the government from competition through a wide variety of mechanisms. Can we amend away some of the false protections for that industry and force them to compete on a level playing field like every other business in America?
Well, that remains to be seen. I think there's probably some parts of that statement I would agree with. There's parts that I would disagree with. Look, this is the Senate bill that we passed. A lot of us over on the House side were very familiar with the House-passed products, even though I didn't support them. I was very familiar with them. We're much less familiar with the Senate bill because, remember, that was passed the night before Christmas. And we all thought it was going to a conference report. We all thought that there would be a different bill that would come out of the Senate ultimately. And now we've got what the Senate passed on Christmas Eve. So it's a very different product than anything we had been dealing with on the House side. Look, mandates are a bad idea. They have no place in a free society. They say the Senate bill has no public option, but it does have a public option because now we have 37 states who say we want to exempt ourselves from the exchanges, and the Office of Personnel Management is now, under the Senate bill, empowered to set up exchanges in those states that won't set up their own. So this is a terribly, terribly difficult process. It's likely to get a little more ugly before it gets better.
Yeah, I don't disagree with that. I do disagree with you a little bit about the mandate, only because every single person in America is drawing health care, and for those who don't want to pay for it to then later expect to get it, it's sort of like car insurance. If the government legal forces people to buy car insurance, they do that to create pool, as you know. You understand risk pooling as well as I do.
Yeah, I do, but car insurance is a state mandate. It's not a national mandate. This will be the first time in the history of this country we've required the purchase of something just simply as a condition for being born in America. That's a vastly different direction than we've ever gone before. You don't have to drive on the roads, and the states do. Some states don't have a mandate, but if the state wants to put a health insurance mandate out there, and they can do that with their good citizens still reelecting them, then good on them. That's what they should do. But
and you and I can go back and forth with this, but let's move on to a couple of other things. As you know, House Minority Leader John Boehner attacked this bill right up to the bitter end. Here's the final part of his speech last night.
Shame on us. Shame on this body. Shame on each and every one of you who substitutes your will and your desires above those of your fellow countrymen.
Where do the Republicans go from here? In other words, at what point, how much longer can the Republicans basically be obstructionist, and at what point do they have to become constructive to this? We know that this bill could be meaningfully better than it is. You could debate single payer, you can debate a national exchange, you can debate vouchers. We all know that the current version, however, is, again, way, way less than perfect. You see David Frum, a conservative writer, talking about the Republican Party. We will make no deal with the administration, no negotiations, no compromise, nothing. We were going for all the marbles. This would be Obama's Waterloo, just as health care was Clinton's in 1994. Is now the time for the Republicans to come back and actually come up with an improvement as opposed to an obstacle?
A couple of things. First off, I'm not in leadership. I don't make the decisions that leadership makes. I did reach my hand across the aisle right after the election to the transition team, and the chairman of my committee got rebuffed both times. So there never really was an interest in working with Republicans. We weren't obstructing anything.
So then compete with them. But hold on.
Democrats that were obstructing.
Listen, everybody's pointing fingers at everybody. All I know is we got one bill that was basically half-baked and another bill that was not even a bill, as opposed to getting one bill that was half-baked and an opposition party that was working on how to actually improve that bill in a way that was catering to the American people. It feels as if the political process is one political party kind of coming up with what they can come up with while accommodating special interest, and the other party just trying to take the first party down, which doesn't do anything for the American people in a two-party system where, in theory, the two parties should be competing for the best solution, not just to destroy each other.
Right, then why not bring both the House and Senate bills to a conference committee and do it the old-fashioned way, which in my opinion would have been the right way? Put Republicans on that conference and yes, let us have a voice as this thing works through.
But when are the Republicans going to stop complaining about what they didn't get, or they'll stop whining about what didn't happen, and just, if you go to the American people...
When you stop asking us.
Paul Ryan came out with what seemed to be a very rational plan. It had a lot of the signature parts of Ron Wyden's Healthy Americans Act, and instead of the Republican Party rallying around Congressman Ryan and saying, listen, this is rational, this makes sense, this can actually improve the quality of what the Democrats are proposing, and getting behind Paul Ryan, Republican leadership, and I know you're not it, so I'm not trying to give you specifically a hard time, but I'm just telling you how I look at it, refused to get behind what was clearly an opportunity to improve it, and in favor of that went with just trying to take down the Democrats, and it kind of leaves the American people with a couple of half-baked pieces of legislation, in my opinion.
I don't disagree that Paul Ryan has excellent ideas, but the problem with Paul's bill is we've just been through a very tough presidential election where the American people had essentially voted against that concept. I gave Paul Ryan's bill the only hearing it's had.
The American people did not vote against having a legitimate opposition party that's actually trying to hold the ruling party's feet to the fire, not by trying to destroy it, but by trying to improve the legislation.
I gave Paul Ryan's bill the only hearing it had up here at Capitol Hill in my health caucus. I think he's got some good ideas. I think Ron Wyden has good ideas. I met with him early in the process, and in fact, one day I wondered if Ron Wyden wouldn't be the compromised product at the end. There were some things that Ron would not compromise on when I talked to him early. We parted ways amicably. Who's to say what will happen in the future?
And I suspect you and I are on the same page on a lot of different things. If you like Ron Wyden, you like Paul Ryan, you like freedom and choice, and you like a free market. Congressman, thank you so much for the time.
I want the doctor to be in charge of the patient.
Yeah, well, listen, I wouldn't mind that myself as a patient, doctor. Thank you so much. I do want to welcome